Hello everyone. Today we'll be learning about SIDS. SIDS is a sudden infant death syndrome that can be avoided if the adult is responsible and is aware of what SIDS is. So today we're going to be learning about it so we can prevent this at every time we put an infant to sleep in their crib. Sudden infant death syndrome is the leading cause of the deaths among infants. In childcare, it is very important that each childcare provider to create safe sleep environments for infants in their classrooms. Also be able to identify the factors that increases the risk of SIDS. List safe sleep practices and implement them in our program and daily training. Provide tummy time to promote healthy development as well as annual training. SIDS is the most common death among kids 1 month to 12 months of age. SIDS remains unexplained after a thorough case investigation, including performance of a complete autopsy, examination of the death scene, and review of the clinical history. SIDS can also be called crib death since it is caused during sleep. Now that you've heard about SIDS, let's find out why it is important. In 2010, more than 2,000 babies died from SIDS. SIDS is a still major issue nationwide. 227 infants died alone in Texas and can occur anytime, any day within first year, but is more likely among kids younger than 6 months, and males are more at risk than females. Since the AAP and other pediatric association came out with Back to Sleep campaign, where an infant is laid down on their back to sleep without anything else in their crib, the SIDS infant death has gone down to 50%. Demand of childcare has increased dramatically. The demand for quality care has also increased. Since young mothers are ready to go back to work, average time an infant spends in the childcare is 22% of their time. Non-parental childcare settings, 20% SIDS death. Family childcare, 60% SIDS death. Childcare centers, 20%. Parents, 20%. Related to sleeping on their stomach, 43% of licensed child care center staff did not even know about the link between sleep position and SIDS. 20 to 20% of child care centers employees continue to place infants to sleep on their stomachs even though they are aware of the risk. Other risk factors that are linked to SIDS are prone sleep position, which means sleeping on the stomach, including unaccustomed tummy sleeping, sleeping on a soft surface, maternal smoking during pregnancy, as well as baby's exposure to secondhand smoke after birth, overheating, late or no prenatal care during the mother's pregnancy, young maternal age, meaning baby's mother is less than 18 years old, preterm birth, meaning the baby is born at least less than 37 weeks gestation, low birth weight of less than 5 pounds, being male. Some racial or ethnic groups are also a greater risk of SIDS than others: African American, American Indian, or Alaskan Natives. Having a child sleep in car seat, a rocking bouncer, and a swing can also be a great risk factor that can be linked to SIDS. It is highly recommended that childcare and parents at home avoid these items to have a child sleep in. There are actions that needs to be taken very seriously to create a safe sleep environment. Post proper flyers and have trainings. Place the child only on their back to put them to sleep. Sleeping on their side can also increase their chances of having SIDS. Unaccustomed tummy sleeping increases the risk of SIDS while sleeping on their tummy. A child should never be placed on their stomach to sleep. Physician's note is required for not putting the child on their back to sleep from the parents. Common reason for not putting children to sleep on their backs can be because of lack of awareness, fear of choking if the baby vomits or spits up, belief that infant sleeps better on their stomach, belief that infants will develop a flat or bald spot on the back of their heads, recognition that infants startle more easily on their backs, belief that infants develop better if they sleep on their stomach. Carefully consider the cribs to prevent SIDS. Safe cribs should always have a firm flat mattress, a mattress that fits snugly against the sides of the crib, and with snug fitted sheets. Secure properly installed parts that are kept in good repair. Slats or posts that are no more than 2 3/8 of an inch apart. Corner posts that are no more than 1 to 16 inch above the end panels. No cutouts area in the headboard or footboard that could lead to entrapment. Free of soft objects and loose beddings. That includes your pacifier attached stuffed animal, blankets, and much more. Maternal smoking and secondhand smoke is a huge risk factor for SID. Pacifier used by infants can reduce SIDS but is not proved and is controversial. Try avoiding having a leash as well as a stuffed animal on your pacifier. Per licensing, an individual who is handing a pacifier attached with stuffed animal in the crib to a child in childcare will be charged $200 fine. Pacifier guidelines. Avoid for at least 4 weeks from the child's birth. Once fallen during sleep, do not reinsert it. Do not force infant to take a pacifier. Pacifier should not be used to delay meals. Pacifier should have ventilation holes and shield at least 1 to 1/4 inches in diameter. Pacifiers should not be coated in any sweet solution. Pacifiers should be cleaned and replaced often. No pacifier with attached leash or stuffed animal at any time, especially in the crib. SIDS rate has decreased as immunization does minimize your risks. All children enrolled are required to have immunization in child care center. Be informed about co-sleeping to make the parents aware. Understand and follow safe sleep policy. You will be subject to disciplinary action if for any reason you or a person that you are aware has failed to follow the safe sleep guidelines. It can help save a life. Show the parents their child's health and safety is important, therefore they should continue to follow the safe sleep guidelines at home. Tummy time, while awake and supervised to play on their tummy. Promote health, physical, and brain development. Strengthen neck, arm, and shoulder muscles. Encourage bonding between the child and the caregiver. Be sure to have one of these posters as a reminder in your classroom and throughout the building. This will not only help the parents but caregivers as well, to always place the baby on his or her back for all sleep times, on a firm sleep surface without any soft objects. Avoid having anyone smoke around the child. Always put a baby with nothing but a blanket, a loose blanket that zips up and their arms are loose. An infant can not only die from SIDS, but it can also die from SUID. These two are very different. SIDS is sudden infant death syndrome, where SUID is sudden unexpected infant death, sometimes known as SUDI, sudden unexpected death in infancy. It's the umbrella, a term that SIDS fall under. Accidentally sleep-related deaths fall under SUID explained category, which can be from SIDS, accidental suffocation, unknown infections, inborn errors of metabolism, cardiac channelopathies, poisoning, or overdose.